News 8 is putting you first tonight with Prostate Health. Prostate cancer is one of the most common cancers found in men, and early diagnosis for many is key. Maureen joining us now with medical professionals in studio B with more on this. Maureen.
Absolutely. First things first, though, if you have any questions about prostate cancer, about screening, about treatment, perhaps about symptoms, call. The number is 585-287-8005. We have doctors here from Rochester Regional Health and UR Medicine, and they will be here through 6:30 to answer all of your questions. Again, 287-8005. Joining me patiently, waiting to answer some questions, is Dr. Anis Fazli. He is with the Center for Urology and Rochester Regional Health System. Thanks for joining us.
My pleasure.
So, first things first, what is prostate cancer?
So prostate cancer is a cancer of the prostate gland, which sits underneath the bladder in men. It is the second leading cause of cancer death among American men after only lung cancer. It is the most common non-skin cancer in American men as well. And the problem is it initially presents very silently. There's no real symptoms for the most part. So early detection and screening is very important to help find the disease in an earlier state to increase the rate of a better cure.
So who would benefit from screening?
So
all men?
The American Urological Association, the American Cancer Society, and many other medical bodies all agree that the men who stand to benefit the most from prostate cancer screening are those men between the ages of 55 and 70 years old with no other concerning risk factors. Now, those concerning risk factors most commonly are either African American race or men who have family history of prostate cancer who might want to be screened earlier, maybe at age 50 or perhaps even sooner depending on their family profile. But the ultimate decision on whether or not to screen for prostate cancer, I must say, is a important, nuanced decision that a doctor and patient have to gauge all the risks and benefits.
All right. Last question and a very quick answer. How many men locally have prostate cancer?
Well, I'm not sure exactly about all the local numbers. I would say, nationally speaking, there are about 200,000 cases of prostate cancer diagnosed locally. Diagnosed nationally, I'm sorry, and about 30,000 prostate cancer deaths per year. And unfortunately, you don't have the local numbers for Rochester itself, but those are the national statistics.
Safe to say, though, we're talking thousands.
Oh, yes, thousands for sure.
Absolutely. One more reason why people should get screened for sure.
Absolutely.
So the phones are starting to ring. We're going to let you get right to them. Thank you, Dr.
Thank you very much.
Okay, and we have other doctors here from Rochester Regional Health and UR Medicine who are going to be answering all of your questions. If you want to, call now, 287-8005. They will be here through 6:30, and we'll be back with more on all of this in just a couple of more minutes.